Welcome, everybody. Thank you so much for being here for this presentation with Betsy Weiss and Justin Porter today. And they are going to be talking to us about how to be an advocate for your health care, which is really, really important. And I'm looking forward to this for my own knowledge. This is part of the Get Ready series that we are just proactively working to have important conversations and link our community with the resources that we all need to be more prepared as we age in a changing world. And there's just been wonderful programs thus far. If you would like, you can always go to our Met How at Home YouTube channel and just go over to the videos, and there's a lot of great programming there. And with that, I'm going to hand it over to Betsy and Justin.
Well, thank you all for being here. I really am. It's always so great to have these conversations because there is a tremendous amount of wisdom in the room and experience in the room, and we need to hear from you as well as you hear from us. I think both Justin and I are happier and do a better job when there's more interaction. So don't be shy about jumping in, and if you start on a chat, we can always unmute you and actually hear your voice even while we're doing some of the presentations. I'm going to talk a little bit first about just some practical tools for getting the most out of healthcare visits and making your voice heard. And then Justin is going to share some of his experience of what he's learned about quality communication. I think, you know, in time past, I think I've kind of thought of this as a relationship that where there's a little bit of differential in power and authority, and that my goal was to make sure all of you knew just how important you are. And I think that what I've learned and what I think I appreciate about Justin's component of this is that it's really about building an effective relationship. And it's not about who's most important, although you are the most important person in the room. And I'll come back to that. I'm going to share my screen because if I don't have notes, I will get lost in my conversation. So there we go. That's my little graphic about how you're taking care of yourself. Again, I'm starting with the line that you are the most important person in the room. When you go for a healthcare visit, it's about you, and it's about you making your voice heard and getting answers to your questions and getting your issues addressed. I am very aware of how hard the last 2 years have been on people who have been trying to access healthcare and also people trying to provide healthcare. I have never met someone who's gone into healthcare as a profession whose primary goal wasn't to serve the people they care for well. And it has been really hard to do that in the last couple of years. And there has been a tremendous amount of bizarre misdirection of our angst and political conversation towards healthcare workers who are trying desperately to do their best. And I think this has created a lot of pain in our healthcare workers. that we should take into account as we interact with them. Not that it's our job to take care of them, but I think it's our goal is to have the same compassion that we have for ourselves, that we can have some compassion for those trying to care for us as well. And in so doing, I think it really has the opportunity to strengthen relationship and improve conversation. And, you know, this is where, again, I think Justin's component of this time will be really useful. This is a way too busy slide, and I don't expect you to read it. What I wanted to cover a little bit is some strategies and tools for helping you get the most out of your time. And a key element of that is to be prepared for an appointment. You and your healthcare provider will have different agendas. The healthcare provider has all these things that they're supposed to check on and make sure they're covering, and they may be far away from what you're there for, or what you want to cover. But some ways to get their list taken care of is to meet their needs with something that doesn't take a lot of your time, like bringing a medication list. It is fascinating to me how often information in electronic records is inaccurate, and you can be instrumental in improving that by providing accurate information and providing accurate information written down. Knowing how you're taking medications and what you're actually doing is so different from what they sometimes think you're doing. If you have an outline of your medical history, that's helpful. I think all questions should be written down before you get to the office. Not that questions can't come up while you're there, but if you go in with your questions written down, you're much more likely to get them answered. And also, if you can define what you want to get out of a visit before you get there, it's really helpful. Lots of times the healthcare providers, they want to cover what your chronic illnesses are, whether they're making you sick from the medication they're giving you. And they may not be so attuned to what you're really there for, which is why you keep staying up at night because of a pain in your hip, or that you're worried about a relative with a new diagnosis, and wondering about what the implications are for your relative and also for you. If you can know how much time is scheduled, that's very helpful, because you will know to say that to set your priorities about what you want to cover, and make sure that if things aren't going to be covered, that that a time is set to cover those things. And I would encourage you to start off by letting your person know in the beginning of the appointment what's most important to cover. It is so interesting how the really heavy stuff is harder to address. And lots of times, as a healthcare provider, the person has their hand on the door and they're leaving, and they tell you, oh, by the way, I've been having rectal bleeding, or, oh, by the way, I'm having impotence and I want to talk about it. And it's those awkward or heavy or, oh, by the way, my partner of 40 years just left me. Those big things that are hard to talk about, that you don't bring up in the beginning of the visit, you bring up as you're leaving, because it's painful or difficult to talk about. And I would encourage you to avoid doing that and try to bring it up in the beginning, so that you make sure that those things that you really care about covering get covered. Before you leave, make sure you ask for written instructions. You can one of the great things about electronic records, I don't know that there are a ton of great things, but you can get a copy of the visit. And I think that's really helpful. and you can check it for accuracy. And if you think there's something there that needs to be corrected, you can ask them to correct it. And make sure you look at your questions. And if they haven't been addressed and you think they need to be, make sure you set up a time when they can be. Meadow at Home has a program where we train volunteers to assist you with your visits. It's called the MedMate program. We have tools that go with this program that give you an outline of how to organize some of your thoughts around a visit. And you're welcome to use the tools without using a MedMate, but we consider this program way underutilized. I don't think anybody ought to go to an appointment without somebody going with them. And the reason for that is that we know from actual science that people remember about 30% of what they're told at a doctor's visit. What that means is that having 2 ears and one person who's writing stuff down while you're listening is better than one set of ears. And even if you've got somebody important with you, like a partner or a close friend who's going with you to the appointment, even so, having a neutral person there with you, I think, can be very helpful, who's taking notes and just being the person to sort of keep track of information. The MedMates are trained to ask you how you want them to function. They can speak or not speak. They can remind you of questions you have or not remind you of questions you have. They can ask for clarification about confusing stuff or not do that, depending on what you're comfortable with. And they are for you to use as you're comfortable. They also review the visit after you're done, and everything about the visit stays with you. The notes stay with you, the lists stay with you. We value confidentiality extremely highly, and anything that goes on at that visit doesn't get shared with anybody but you. And you can have confidence in that. If you're facing a big diagnosis or a new decision, here again, I think lots of times the healthcare providers aren't aware of what your biggest concerns are and won't be aware unless you tell them. And if they're good, sometimes they make the space to ask for that information. But if they don't, if you're worried about the impact it's going to have on your partner, if you're worried about that you have a skin cancer and your best friend died of skin cancer, sharing that information is really helpful. It's also important to know that you can always say no to something that is offered you or is presented as the only option, and that you are in charge of the decision making. If you need time to think about what your choices are, you can almost always take time. And should never be seen as awkward or difficult to ask for another opinion from another source. Any healthcare provider who you want to have care for you will value your being comfortable with the choice of care that you're making, and getting another opinion is totally appropriate, and it should never be seen as an awkward request. Listen to your intuition. If you're uncomfortable, take your time, ask for more information, think about what you're being told, and don't feel pressured by the situation. This is a hard one. The last one is a hard one. Understanding financing of healthcare is mystical, and it is incredibly difficult to get information about how much things cost. But this problem will not get better unless we agitate for it. you will often be told, we can't tell you, we don't know, it depends on this or that. Your insurance coverage is good. We do know that medical expenses are the leading cause of bankruptcy in this country, and at least it has been to this point. It may be that housing is becoming that, but to this point, healthcare has been the leading cause of bankruptcy, and trying to get that information is totally legitimate. So I encourage you to ask those questions. And I think I am done with my piece, and I'm trying to get to the stop sharing my screen thing. There. Now I'm gonna, if you don't have it, we could have some questions now. I think I'd prefer to have Justin do his piece, and then if you have any questions, if you want to have something to add or say, or share, we could do it a little later. That makes sense?
That sounds good.
Okay.
Okay. Hello, everybody. I'm Justin. I'm trying to get to my screen share right. Hang on one second. Okay. All right.
Yeah, we can. There you go.
Hold on. I got to switch the settings. There we go. All right. Thank you for having me. And thank you, Betsy, for that. I think you've set the scene well for what I'm going to talk about, which is navigating 3 common healthcare obstacles. And by no means are there just 3. There's a gajillion. And I've just kind of picked 3 that I thought I could talk about, and 3 common ones. So first, about me. Like, the only thing you need to know about me, really, in this conversation and why I'm here is because I work in healthcare, and my whole thing in life and in healthcare is this: people don't care what you know until they know that you care. Like, that's my whole vibe. And I've spent a lot of time trying to bring that in and display that when I'm with patients. So I spent a lot of time working on communication and how I communicate with patients. And it's bled into kind of everywhere in my life, this training that I've done and this work that I've done on healthcare communication. And so I think I've become okay at it. And I also have found it's adaptable and universal. And I thought some of the things that I learned could be applied on the other side of the bed, right? Like, patients could use these communication skills. So what I'm doing is kind of taking some of the greatest hits of what I know and applying it to these obstacles. All right. So I'm just going to share with you, before I go any further, I want to say just what Betsy said is, please unmute and interrupt me. I present so much better when I have dialogue back and forth. Staring and talking to a piece of screen is not me. So please unmute and talk to me. And I'm going to ask for it too. There's going to be times as I talk that I ask you to unmute and give me an anecdote, give me a story, give me an experience. All right. So, and I guess I'll say one more thing about this, which is, in preparing for this talk, I hope that you all feel cared for. Like, that's important for me that you feel cared for. And so if anything comes up, voice your feedback, push back, or tell me what's not sitting right. All right, so the takeaways for today. The first one, and we're going to dive into these. I just want to sort of preview them. The first one is to know yourself before you go into a healthcare setting. Know yourself. That can include the biases that might be leveraged against you. It might be, and we're not going to talk about this very much, but what's your conflict style? How do you deal with conflict? Decide what you want out of the visit. And Betsy hammered this, and she did a great job of it. Go prepared. Go with a list. Go with a partner. Go with a buddy. The third thing that we're going to talk about, and we're going to use a skit to do this, is have buoys. What do I mean by buoys? I mean things to grab onto when it's stressful, when it's hard, when you're confused. So have buoys in your life. And then the last thing is, and this is going to be the hardest for me to talk about, is attribute positive intent. And we'll get to that. Okay. So here are the 3 obstacles in healthcare that I thought we could talk about. Again, there are a ton more. The 3 that are on here are bias, time crunch practitioners, and not understanding the healthcare information. So like I said, I'm going to ask you to unmute. I want a story or an experience about one of these, each of them, from you all. And it doesn't have to be in the order that they're delivered. So someone can give me a story or an experience about not understanding healthcare information that they had, or time crunch or distracted practitioners, or someone who experienced bias in a healthcare setting. So please unmute. I know these exist out there. I know everyone's had them. My daughter is sitting with me, and she just asked me, "Is anybody listening?"
Hey, dude, I'm listening.
All right, thank you.
Justin.
There we go.
Thanks
Thank
for
you.
being here, man. And yeah, I thought I'd just echo into the space here. Really appreciate your attitude. Really appreciate your spirit. And yeah, I don't know. It's like one thing I'm wondering about, like it's kind of off topic, but maybe not. It's kind of, well, I use my phone a lot for like because I do have a I kind of give my power away sometimes to a doctor or something like that, and I've learned that that I'm probably not going to be at my best. So I come prepared, like with my I've got a Apple, iPhone, whatever. But I'll put notes on it, things that I want to talk about, things that I don't want to miss. Another thing is I use Confluence a lot, and I use my chart. And for example, I'm taking care of my mother-in-law right now. She's 98, or she's 89 rather, and had some challenges. And so, like, what I just did is I loaded up my chart with all this, all the pain management that I'm going to an appointment tomorrow. And so I loaded up my chart. It took like 4 or 5 different little, things for me to put it all on there. But I'm doing that, then they can refer. Is that like real world? Is that cool? I mean, like, it seemed like the last time I did that, the doctor was able to just look on it and just go, oh, okay, I see that you've got all this, and concisely, instead of me handing them something they got to figure out, it was right on the screen for them.
I think that's excellent. I just thank you for that. And ding, ding, ding. You nailed it. Yes. Going prepared, using your phone, using the tools that you're comfortable with is like, that's exactly what I think Betsy and I are talking about to overcome these obstacles. I think that's excellent. And so, like, that's going to help you overcome potentially any of these in the right scenario. Having that phone loaded up with your notes and being prepared ahead of time, I think you'll see as I go through these slides, is like, for most part, is going to help you get through all of them. Thank you.
Cool. Thanks.
How about anybody else? Has anybody experienced a healthcare professional just staring at their screen and not feeling cared for? How about that? My daughter's raising her hand. Okay. All right.
I've been misdiagnosed, dude, by a drunk. And I lost my radio head from it. Yeah, I can relate. Yeah.
Okay. Thank you. All right, let's go on to look at these individually. Okay, so bias. I want to talk about bias a little bit. It's not really specific bias. It can be not bad or it can be bad. And I have a picture of garlic up here because I have a hard-earned bias against garlic. I used to like garlic. I used to cook with garlic all the time. I grew up eating garlic. My mom cooked with garlic. My bias against garlic doesn't hurt anybody, but it is a bias. Where does it come from? It comes from martial arts. I did martial arts for a number of years, and grappling with opponents who had sriracha on their eggs or garlicky stew or Chinese food it got me in a place where I didn't like garlic anymore. So now I don't cook with garlic. I don't like garlic. So garlic's out of my life. I have a bias against it. Not necessarily bad. Bias against people or groups because of certain traits, that's where it's bad. And when there's power dynamics, the way there can be in a healthcare setting, there can be harm. So I'm wondering, just unmute. I'm going to keep asking for participation. What are some forms of bias that can happen from a healthcare professional to a patient in a healthcare setting? Anyone can spout them out.
I'd like to speak,
Yeah, please do.
and I have a little story to go with it.
Perfect.
I think that there's a bias against people, women of a certain age. So I had severe abdominal pain for more than 24 hours. Went to the urgent care. They did all of these tests. I thought that was good, but they were unable to come up with anything. So the next thing I knew, a nurse's assistant, a very young woman who was not the doctor, came in and in a rather embarrassed way explained to me that my symptoms were due to menopause. And I thought, what? To me, it was an incredible bias that had to do with my gender and my age, because I couldn't find anything. And so it had to be something, and the bias took over. It was my reading of it. So there you go.
I think that's a great illustration. And where bias becomes really problematic in healthcare, and thank you for that, Teresa, where bias becomes really problematic is where people receive poor treatment or aren't diagnosed or are diagnosed late into the condition. And bias plays a part in that. I'll share a story that I have that relates to bias. I worked on a pediatric flight team in a major metropolitan city in the Midwest. And I remember when I was going through orientation to be on the flight team, a coworker who had been on the flight team for decades told me that he thought that we were standing in the neonatal intensive care unit, and we were with a number of children, but one of them was a little black girl in the NICU. And I remember my coworker telling me that little black girls are bulletproof. And what he meant by that was that they're tough. They're really tough. The little black girls was his belief that they were really tough. It was coming from a place of respect. It wasn't coming from a bad place necessarily, but you can imagine, and it didn't hit me right then. Later, I started to process it and metabolize what that could mean for a little black girl in the NICU, right? Like, what if that child was showing signs of pain and she can't tell you? How might she get care that's different from a little white baby or a little Asian baby that's in the NICU? Or how about how someone might change that baby's diaper in the NICU? Would they be a little more rough? So it can have an impact, this bias, even though it's not coming from necessarily a bad place. It can have an impact on the care that the person, the patient, have an impact on their life. So how do we overcome bias? And there isn't a lot. As I was preparing for this, I tried to look for information, peer-reviewed literature on how patients can overcome bias in a healthcare setting. And I didn't find a lot, really much at all. There's information on how to overcome bias in the workplace. There's information on how to overcome bias when you're trying to buy real estate. But there isn't, what I found, a bunch of information on how to navigate in a healthcare setting. So I've come up with two, again, not peer-reviewed, not in the literature, ideas of how to, and this is based on other experiences I have with learning about bias in healthcare, but not for the patient. It's not patient-centered. So two ideas. One is to anticipate, and I think, Teresa, you're there now, is what I'm hearing, but to anticipate how bias might be used in your healthcare setting. So what are the ways that I might experience bias here? One could be my age. One could be my gender. Another could be the medications that I'm already on. Another way could be the diagnosis that I have. Someone with depression might get might experience bias based on the symptoms that they're having. Weight can be another one. Of course, race and gender and sexuality. So that's the first one. That's the first of the two, which is to anticipate the bias that you might experience. The second one comes from sort of getting ready and exploring the information for this talk, comes from the Institute for Better Healthcare, or the Institute for Healthcare Improvement. And they have this initiative called Ask Me 3. And Ask Me 3 has patients ask their provider to repeat back to them 3 things. The 3 questions are, what is my problem? What do I need to do? And why is it important for me to do this? And I think by having those questions answered by your provider, you might be able to illuminate the bias that you're experiencing. An example that I came up with was someone who's had back pain for decades and has recently gained weight. They go in to talk to their provider about the back pain again, and their provider, the person asks these 3 questions. What is my problem? And the provider says, you're overweight and you need to lose weight. This would illuminate the sort of bias about the weight and not get to the root, what the patient believes is the root, which is the back pain, which may or may not be related to the weight. Okay, so that's bias. Anything there before we move on to the next obstacle?
I'd like to say something.
Yes.
I'm Carol. It has improved. The bias has improved. Women are treated much better. We don't immediately go in and assume that everything's in our head, which is what we heard 50 years ago, 40 years ago. Everything was in our head. However, as an old woman, when my healthcare provider doesn't know me, like in the old days, like Dr. Diamond, she knew what I was like, knew I was an athlete, knew what to expect. They treat you different. And if they don't know you, then you think, well, there's this little old lady and she doesn't need to move that much, so it doesn't matter if her knee hurts. So that's sort of a bias.
Yeah.
Yeah, I was gonna just mention that I listened to an interesting code switch that there can be bias the other way, where in somebody, I don't remember the exact precise story, but it was basically this woman had a hand injury. She went in to the hospital, and maybe it was even Yale or something like that. And they were kind of like, oh, what do you do? Well, I'm a crafter. My hand is important to me. But that doctor didn't value that until they knew that she was like a high up faculty member. And then all of a sudden the treatment plan completely switched and changed so that she was getting a specialist coming in from somewhere else. And so the bias can go kind of both ways, which I think is interesting. Betsy.
I'm thinking about Teresa's story, and it breaks my heart that you have to, when you're already vulnerable and hurting, that's when you get sort of devalued by that, and that it's so difficult to confront the bias. That it is one of the reasons why I think having somebody with you who can be an advocate can be really helpful. That, when you're sick, it's harder to speak up for yourself. I mean, I think it's great when you're able to, but it is really nice to have somebody else there who can say, this isn't a change. This is different from usual. This isn't, she doesn't always come to the emergency room with pain in her belly. And you may not have an answer for what it is, but that doesn't make it not real. I watched my son advocate for himself after a major bicycle accident, and he had a big fracture of his ankle, and his father was in the intensive care unit from the same accident, having had a major trauma. And this orthopedic resident came in to see him, and he was hurting a lot, and it was really scary for him. He has other health issues, and this orthopedic resident was stressed. You could see that her day was not going well, and she wanted him out of the hospital. And he was able, he had me there. I'm a doctor. He had his uncle there, who was a doctor. And I think partly because we were there, he was so much better than I would have been. But he was able to say, what I really need to know from you is if this pain is dangerous. I need to hear from you what the significance of this is. And if it's something I'm supposed to just manage, I can do that, but I need more information from you. And she did not respond particularly well. But it was really fascinating. I mean, I think she saw him as seeking pain medicine. That's what she saw, which was really not the issue, but it was interesting.
Thank you. I think those are all excellent stories. And have you ever, it's just making me reflect on the experience of like being stressed out and actually having something good come out of my mouth. It feels like I hit a home run blindfolded. It's unbelievable. And so what I'm saying is it's really rare. It's really rare that something useful comes out of my mouth when I'm that stressed out and hurting and in a fight or flight kind of mode. So one of the things that we're going to talk about in the next few slides is this idea of buoys. And I think, although we're not going to talk about buoys with bias necessarily, I think that we can all develop buoys around this idea of bias too. It's the concept of the buoy that I think is helpful, and then you can develop your own. So I did see one question in the chat about bias against Medicare patients. I think from Don, I think that the spirit of that question is like, are people treated different because healthcare institutions know that they're going to be reimbursed differently because that patient has Medicare? It's a great question. I don't have a lot to say. It's not something that I consider at all. And I think I would admit to it if I considered it in any of my activity in healthcare. Betsy, do you have anything to add to that?
I think I've seen this less with Medicare than with Medicaid, both of which are alter reimbursement. And I think it rarely happens on the provider, or less commonly happens on the provider level, but certainly happens on an institutional level.
Yeah. Okay. Thank you.
Can I just jump in one more little time? I don't want to take someone else's time, but another place where I have experienced bias is I tend to be more on like a natural side of things. And so it's really helped me like in pregnancy, also, just going through my husband's kidney transplant and things like that. There's definitely a bias when you want a more natural option or approach, or just to have things explained a little bit more. And so it really helps to have that advocate within the system. It was funny because like the nurses were kind of making fun of my friend who was my sort of advocate, overheard them like at the station, like, oh, another no-B, no, doesn't want any OB, the regular stuff. And so, yeah, I think that's another place where it's helpful to have that a plan and somebody who's going to advocate for you, because you're just too out of it to advocate for yourself.
Absolutely. I think that's a great one, especially in our community. There are a lot of people with those preferences. I think that's an excellent one. It's one that came to mind for me today. It's one that comes up for me as someone with like, as someone with like high views of like Western medicine and tends to go that way, it came up for me that that could be a bias for me. I think I'll share one more, and then we'll go on to this next thing, which is overcoming distracted practitioners. A bias that I carry and I've really worked on over the past 2 years in healthcare is the way that we talk about people who really struggle with drug abuse can be really unkind in healthcare. And I've really been working on that. And I realized how much it could create a bias in the care that I deliver. Because someone has a substance abuse problem and a legal history, it doesn't mean that they shouldn't still, get excellent care. And like part of my like fundamental to me is this belief that everyone is somebody's baby. And like just because you have been in, prison and had drug problems doesn't mean you shouldn't get good health care in this moment. So that's one that I've worked on and that I've come across and noticed in myself. All right, so overcoming distracted practitioners. For me, this is the hardest one to talk about with you because I think what I have to offer is what's helped me deal with people that seem hard and where I want to judge them a little bit. So that's what I'm gonna offer you, and I hope it comes off as genuine and not sort of like condescending or anything like that. It's also hard for me to talk about it because healthcare providers are distracted. They're working super hard, and the tools that we're given to work for you are screens. And culturally, I think screens, when you're trying to talk to someone and they're text messaging someone, it feels rude. And then you go into your healthcare setting and there's this cultural expectation of eye contact, yet the tool that we use to deliver your care is computer. So it makes it really hard. So I'm just acknowledging that. So what I have to offer is this idea when you do come across distracted practitioners, and I think that this connects to my whole vibe, which is like people don't care what you know until they know that you care. I think this helps me do it, which is this idea of attributing positive intent. Attributing positive intent for me, when I can use it, when I'm like able to utilize that idea, is a superpower. It changes my relationship with whatever interaction that I had. So what does attributing positive intent, like, what does that sound like to you in a healthcare setting? What does that mean to you? Give me a little feedback about what that sounds like to you.
Again, just a reminder to folks that most people are muted, so check your mute button if you're talking and you don't get a response.
So clarify that for me, Justin. What was the question?
The question is, what does attributing positive intent, what do you think that means in a healthcare setting with distracted practitioners or healthcare?
Okay, well, for me, it would be like having a little empathy or compassion for the overworked, I don't know about underpaid. I would assume that, either way, whatever, that's kind of my bias, obviously, I just noticed, and I'm busting myself about it, but that said, it would probably be like, even some humanity. It's kind of like, I know that we've got limited time, but I need some eye contact. Can you just step away from the screen for a minute, turn your chair over? Can we just like connect, or however you want to phrase that in your own terminology, but just kind of make a human moment.
Exactly. I think that's well said. I think that's perfectly said. So I think it's helpful for me because like it takes the framing of this is a distracted jerk to this is a hardworking person who's addressing multiple tasks at once. So like, why does this well-meaning person seem so distracted? I get to ask myself that question. And instead of it being about their disposition, they're a jerk, it's about the situation. So I take myself out of that like sort of cycle of negativity and like blame. I think this is hard for me to talk about because like here I am, a healthcare professional, telling you, the patient, to think highly of us. That's why it's uncomfortable for me, or to like take this step of compassion for us. That's hard for me to ask for, but I think like it is a superpower. If you can do that, it changes your life every time that you're able to do it. For me, it takes me out of any sort of like place where I want to feel like I'm like I have no agency. It puts me in a place to have agency. So if anyone has,
Yeah, I have some stuff to say.
please do. Thank you.
I hope I hope this comes across all right. I have a background as a healthcare provider, as a clinical psychologist. So I heard a lot about bad patients, and a lot of bad patients were referred to the psychologists, right? And one of my personal concerns was I didn't want to come across as a bad patient because I knew what happened to bad patients. And that led me to what I guess it was Byron was talking about, of trying to establish some connection with the healthcare provider, whether they were the doctor or the assistant, whoever. And also, and this is not necessarily good, but masking my negative emotions. So I would go into, and I do go into a medical appointment thinking, well, I'm scared, I'm angry, is this person going to help me or not? And to put that aside and instead look at the person who's trying to help me and say, wow, we got snow today. Just some kind of reaching out that makes me human. And to have an attitude of, I hope I'm saying this right, objectifying myself. I have these symptoms, they're A, B, and C. I really want to do something about them. And to say that in a calm voice, well, maybe I've said enough.
No, thank you for that.
Yeah.
Thank you. Anybody else have anything to add on this? I think
one of my complaints is that having patients have to take care of their providers. I really, I don't think that's really the, but I like, and it's a human interaction and it's a collaboration, and we do have to be tuned into where they are as well as where we are in order to build a relationship. I think the screen does serve a purpose is a tool for the provider. It's a way of trying to accurately enter what you're hearing at the time you're hearing it, rather than trying to write it up later. And again, we know that there's a lot of misinformation in a medical record, and it's trying to do it simultaneously with when you're seeing somebody can be helpful. I find it hard not to look at people. I'm a terrible typist. Yeah. So when I had to do the typing, I had to look at my fingers, and it was I didn't like it. So
thank you for that. I think that both Teresa and Byron brought up the idea of sort of like pulling the healthcare professional towards the moment and talking to them. And I think that's a great idea if you're comfortable with it and you have a conflict, sort of like a conflict style, that would be an easy thing for you to do. If you know yourself and that when you do something like that, it's going to create conflict. If you have that self-awareness, I think finding a different way or finding a buoy to do that would be a good idea. But if you're laid back like that and you can say that kind of thing, I think that's a great idea. We have some comments from Laura. She didn't have problems with screens, and she feels sorry for doctors who have limited time. Yeah, thank you for that. All right. Anything else on this, distracted practitioners? All right, let's move on. All right. overcoming confusing healthcare information. So Betsy and I are going to do a little skit, and I'm going to be the doctor, and Betsy is going to be the patient. And really, all you need to know about Betsy is she has pain, and that's why she came here today. So I'm gonna put on my props, and Betsy. All right. So I'm gonna start. Knock knock. Your A1C has resulted, and it is 7%. And we really need to get that down. We need to get your glucose down. I've printed some information for you, and you can review that at home. The nurse will be in to draw labs. Is there anything else I can do for you?
Okay, thank you.
Anything else?
My pain is bad. Did those scripts get sent to the pharmacy?
Let me check. Yeah, they should be there. Anything else? No, there's nothing else. Okay, all right. So now we're going to do the same scenario, but now we're going to offer Betsy a buoy. A buoy is something to hold on to grab onto when you're in that fight or flight mode. It's just there. You know it's there. You're feeling like you're starting to drown. You just need a little bit of time and space to figure things out. I think this is an excellent place to use a buoy to overcome confusing healthcare information. A buoy that I use everywhere in my life is this simple statement, tell me more. Why do I like tell me more? Because it has no conflict in it. There's not the why word, which can be so full of conflict. Like, why'd you do that? Right? Why'd you say that? That kind of thing. So tell me more is really nice because it's like really open-ended. And I find when I say tell me more, the conflict or the tension resolves by asking that question. And when it doesn't, it gives me the space to keep exploring in my mind, what do I need to do here to make this understandable or better or less tense? Okay, so I'll offer Betsy, tell me more. And as we go through this, so Betsy, when you see the word buoy, all you say is tell me more. And we'll get a different result because I have predetermined that this result will be different because it's my presentation. So, but I want you to think about buoys in your life that you might use in a situation like this. Okay, so here we go. Are you ready? Knock, knock. Your A1C has resulted and it's over 7%. We really need to get your glucose down. I've printed some information for you that you can review at home, and the nurse will be in to draw labs. Is there anything else I can do for you?
Tell me more.
So the reason why a buoy is there is because who knows what an A1C is? Who knows what 7% means? Betsy didn't in this situation. So tell me more. She's eliciting this from me that she didn't understand without having to figure out what to say. She could say, I don't understand what you're talking about, but sometimes that can be hard. That can be hard to admit to. So having that buoy, tell me more. It's applicable in a ton of different scenarios. Just throw it out there. Tell me more. So I respond, your A1C is a blood test for diabetes. It measures your average blood sugar, and it's a level over 3 months.
I see. Thank you for explaining that. I guess I'm confused about how this relates to the reason I'm here, which is my pain.
Okay, like I said, my presentation, the outcome was predetermined, and it turns out great. She gets to express herself in a great way and get down to the brass tacks of why she's here. I'm wondering, this is my buoy, tell me more, but you can have any buoy you want in a healthcare setting, or not in a healthcare setting, at home, at work, whatever it is. I'm wondering, does this resonate for you? What buoys do you have in your life as I frame it this way? Does it come up for anybody?
Well, I think that, for me, just if I notice, oh, I'm I'm doing that thing, I'm like going blank, or I'm like getting agitated, or I want out of this office right now, then just taking that deep breath, that would be my buoy, just to
There you
take
go.
3 breaths
Yeah.
and then be able to, say like, I'm feeling a little confused here or whatnot.
Absolutely.
Well, I think it's just great to have an alternative to I don't understand.
Yeah.
Just to simply say, tell me more. I appreciate that.
Great. And I encourage you to use this in your life. Like, practice it with your spouse or your coworker or your child, whoever it is in your life. When it's starting to get tense or you don't understand something, just put it out there. Tell me more. And I find that it's a great little bridge to understanding for both sides. Yeah, and I think Tracy, you brought up breath. For me, when this is about settling ourselves in these hard situations, really. And I think a buoy gives us time and space and like a predetermined thing to say in these hard situations. But I think this is really about settling ourselves. And one thing that I use to settle myself is my hands. When I'm feeling stressed out, my hands are a big source of comfort. And just rubbing them is like a buoy to me as well. I also use quotes a lot, like a quote that really means something to me. If I can memorize that and then use it, it's like, oh, this means a lot to me, and I think it applies here. It gives me that time and space in stressful situations. Okay. All right. Anything else on this, on buoys or confusing healthcare information that people have experienced?
I don't know if this is too off track, but one of the things that I found it difficult to do as a healthcare provider was to say, I don't know.
Yeah.
Or I don't think I can help you, without saying, and it's all in your head. And so I wish that maybe there was more in the training of healthcare providers, or maybe as a patient, I could say, it sounds to me like you really don't have an answer for me, or it sounds to me like you particularly can't help me. Is there somebody who can? But I wish more often that the healthcare providers would say that. I wish I had said it.
Absolutely.
Yeah.
I think that's a really good point. And that's why I think this phrase, people don't care what you know until they know that you care, is so important, because my first job is to care for you. I don't always have to know what's wrong. And I think that a little bit of the fallacy of expertise and the power dynamics in healthcare are problematic for that very reason, because there are times when we don't know what the hell's going on, but we can still care for you, and we can still demonstrate care for you, and also see and empathize how hard it is what you're going through, even though we don't have answers. Thank you for that. Okay. Get through these. Thank you, Betsy, for being my patient in there. All right, so my hopes for today. This is my last slide. My hopes that what you take away from this is to give thought to the biases that you might experience in healthcare. Plan your goals out ahead of time. Be prepared, like Byron said. Have it on your phone or have a list. Know what you want to get out of the visit. And you can ask me 3 questions. Create buoys in your life, all through your life, create buoys. And then if you can, harness that superpower of attributing positive intent. And I think those things will help you get over some healthcare obstacles. Thank you. I will end my screen share.
So I have a question.
Yes.
Can you hear me?
Yes, great.
Would you repeat the 3 questions? I only got the first one.
The ask me.
The 3 asked me's, yeah.
Okay. Let me get back to my. It is.
What is my problem? What do I need to do?
Yeah.
And then, yeah, I didn't get the third one either.
I'll pull them up. Ask me 3. Okay.
everybody's
No.
Can I have it?
Sure.
Okay.
Okay, here's the Ask Me 3. So here's Institute for Healthcare Improvement. And then, what is my problem? What do I need to do? And why is it important to me to do this? And I brought this up I think this is a valuable thing to do no matter what, but I brought it up in the context of bias, of illuminating bias that might be there. And I think you might be able to sort of like explore that and see that as you ask these questions, that there might be bias there, and how the sort of conclusions that the healthcare professionals come to.
I think that the issue of sort of giving permission to the healthcare provider to not have an answer is an interesting strategy. I think it can be a little fraught in that healthcare providers always feel like, often, not always, it used to feel to me in practice like the important thing was to, if I didn't have an answer, to be able to say that, and then to say, okay, so what's the next step, or how do I walk with you through the next step? It often takes a little time and intention to get to that point, and it's to have clarity always feels easier. But it's, there's an awful lot of healthcare that's not clear. That's just the truth of it. And acknowledging that, sort of helping the healthcare provider, or being able to say what you need from the healthcare provider, I think might support them in allowing for the unknowing mind that they don't have the answer. So that's okay. It's okay that you don't have the answer. What I need is for you to help me with the next step. I understand that this can be, this may not be clear right now, but where do we go from here? The problem for me is that why I think often it's helpful to have a person with you, is that in that setting, there's a lot of emotion and there's a lot of vulnerability. And I think that's why, Justin, why preparation is so helpful, and why having the buoy, practicing the buoy ahead of time is super helpful, so that it comes out more gracefully and naturally and with less, what my family tradition of communication was, when you get anxious, you get louder. And that's not necessarily helpful in the context of a doctor's office. But anyway, I'll stop talking.
Well, I don't know what our time is. I've got a story, but I don't want to run over either. So, whatever. If you want to hear it, that's fine. If not, that's cool too.
Yeah, well, we're already a little over. So if folks need to move on, go ahead. But yeah, go ahead, Byron.
Okay, cool. I'm feeling on several levels why I want to share this, but so like I used to have an adversarial attitude with healthcare professionals in general, and my dad went into the emergency room over on Woodby Island like back in '09, and he had like a hernia, and his gut was twisted, and so he was backing up, and he asphyxiated, right? Well, the thing is like I was in the emergency room, and there was this emergency room doctor who was obviously, he was kind of stressed, and like, anyway, they sent my dad to Verbarium, right? And so he came back, and he was prone, and he wasn't sitting up. And I noticed it at the time and went, that's a little weird, but but I was his advocate. I was there because they weren't going to be doing their jobs. And so like I had to do it. And so I thought I was covering all the bases, blood pressure, all that kind of stuff, stats. And what happened? His vitals went down for about like 20 minutes, and the doctor didn't know what to do. And what he was doing, he was aspirating all that junk in his gut into his lungs, and he was dying. And like, but it took him another 36 hours to do it. And so, and bear with me, here, but it's like, so I transferred him out of that little clinic, in Coopville, and we went to Everett. And on the ride, the ambulance guys were the same ones who took him from Oak Harbor to Coopville. And they were going, whoa, he's, this is real different all of a sudden. And it took a while. They did a hernia operation on him. And that was a problem because I already knew about that. So I was loaded, me up, but he had the flu. And so there was a lot of, what I'm trying to say, there was a lot of factors, right, that went on. But what ended up happening, he had a perfectly great hernia operation, and the aspiration, he never came out of it. And so I had to unplug him. And thank God I had the power of attorney. Get that. And so I was able to unplug him, and it was horrific. I watched him take his last breaths and everything. Okay. Here, I'm not done with my story. Here's the story. Here's what's really meaningful to me. I really resented that ER doc. But what happened was I was installer, I was I installed solar electric and stuff. And I did it on this doctor's house. Turned out that the doctor was working in the ER, the same hospital. And so rather than sue that doctor, rather than confront him, I just told this doctor what happened. I said, would you please tell your staff when a patient comes back from the x-ray, man, have them elevated, please. I think that might have been really, that might have helped my dad. And so he said, you got it. And so and that helped me start. Now I don't have, I've healed, I'm healing, let's put it that way, my biases. And I'm looking at medical professionals. Thank God you're here. And I thank you so much. And I just had a really beautiful experience down in Three Rivers the last couple, like about a month ago. And it was beautiful with a person I know that I was advocating for. And so, yeah, but what I ended up doing was not taking out the anger. I just somehow didn't want to litigate and all that kind of, my brother did incredibly, he wanted to, I didn't allow it. And so, but I dealt with it indirectly, but that guy I still have the email, the doctor, the guy who he said, I will make sure, and he emailed me and said, yes, I have talked to staff and we have brought in that, we're implementing that now. I said, thank you. That's my story.
Thank you for sharing that.
Yeah.
I have one question. This is Carol. I would like to ask how you can talk to doctors and have a discussion about your treatment when you might have disagree with what they're doing because you know a little bit about it, or how to get them in the discussion, because usually they're too distracted or don't want to deal, like, why are we doing it this way? Why aren't we doing it another way? How can you do that gracefully?
I think I would, Betsy, please add on to this, but I think I would start with knowing your goals. And it sounds like you would in this situation. Know your goals, know what you want out of the visit, and to bring that prepared to the visit. I think one of the things that's changed, and Betsy, you touched on this, is that I think in the past it was more like the doctor was the authority figure and you do what the doctor says. And I think things have changed where you're the boss, the patient is the boss. And as long as you understand the risks, you should be able to access the healthcare, the treatment option that makes sense for you. Betsy, do you have anything to add to that?
I think that's, I don't think you have any reason to feel like your voice, your voice is critical to this conversation. And if they're someone who you have a relationship with, bringing your thoughts and ideas about your treatment is paramount. I mean, if you're not feeling good about your treatment, then it won't be as helpful, and they need to know that. So I think that Justin's suggestion about having the buoy to prompt the conversation is, that one about tell me more about why we're doing it this way. What is your rationale for why this is the best option? And these are my concerns about it. I don't feel like I'm getting the results I'm looking for. I feel like I'm having some side effects, whatever it is, I think the barrier, as much as anything, is that sense that you have a legitimate reason to have a dialogue around it, and you totally do, and they and again, it's part of a good relationship that you can bring those things up, and one thing is asking for the amount of time that you think you need up front, saying, I think I need 20 minutes to focus on this issue with you, or whatever,
Good idea.
I think another piece too is it can be hard, especially in a small town, to say like, I think I want a second opinion, or that feeling of like going against someone. A lot of times we know these people well and personally, and so that can be really hard. And I love that we have the Lookout Coalition in this valley, who, these are retired physicians with a lot of experience who have time, who can sit down for an hour and do that a couple times with people. And I love that, because we're not going to get that from our physician. And so having those clarifying conversations with another professional, it can also just be really, really helpful.
Yeah, and the Lookout Coalition is happy to help people, support people in defining healthcare goals.
Isn't it important to notice how you're feeling about the person that's providing your healthcare too? I mean, if you don't feel safe saying something, maybe it's time to find somebody that you do. I mean, maybe we'll check out the reason why anyway.
That's a really interesting point. And, I think that it's not your job to make your healthcare provider feel better. But I think most healthcare providers appreciate the opportunity to hear from you. And when things aren't going well, they appreciate the opportunity to make it better if they can. And so if you have the energy to bring your concerns forward, I think there's the potential of really strengthening a relationship rather than simply diverting another direction. Because all of us can screw up or not listen well, or make I remember saying something to a person about an x-ray of their hands. Well, it turns out the way I said it was devastating to them. I mean, that was very distressing to the person, how she heard what I said. And, without her telling me, I would never have known. I would never have appreciated the impact my comment had on her. So I was really grateful for her bringing that to me. Anyway, we gotta
Well,
quit, I think, huh?
yeah, it's been a wonderful conversation. I want to respect Justin and Betsy's and everyone's time. And so thank you so much, everybody, for just bringing your questions, your participation. Justin and Betsy, thanks for bringing your expertise to the conversation.
Well, I really am grateful to you, Justin, for taking us in the direction that you did. It was, I think, really valuable. And thank you, everyone, for sharing your experiences and being willing to participate. It's and to be here, just to be here. It's great. Thank you.
Thank you.
Thank you.
On.
All right. Enjoy.